Everybody knows somebody who is suffering or has suffered from addiction, whether it's from prescribed medications, alcohol, smoking, or any other addictive substances or paraphernalia.
Now you may be asking yourselves, what is addiction? Well, according to the National Mental Health Institute, a substance use disorder is a treatable mental disorder that affects the brain and behavior, leading to a person's inability to control their use of legal, illegal drugs, alcohol, and medications.
Addiction can be caused by mental illness as well as substance abuse. Addiction is a form of mental illness in itself because it affects the way your brain works. What really is mental illness?
Mental illness can be defined as a health condition involving changes in emotions, thinking, or behavior. Mental illness can be the cause of distress or functioning in work, social, or family activities. In some cases, drugs and mental illness may coexist. Mental disorders such as anxiety, depression, or schizophrenia may come before addictions. In other cases, drugs use may trigger or worsen those mental health conditions.
There are many mental illnesses that are directly related to addiction, including anxiety, depression, PTSD, and schizophrenia. This is due to many individuals using substances to cope with or control their physical or psychological symptoms. But this is not the healthiest way to cope with these illnesses. And often, this will further the struggles with the mental illness or cause other troubles.
So, what can we do to help? Number 1, knowledge is power. Educate yourself. The more you know, the easier it is to understand what that person is going through. And when you understand what that person is going through, the road to recovery is easier. Number 2, offer your support. When that person knows that they're loved and supported, it's going to make that road to recovery a lot easier for them, knowing that they have your support and that they're loved without being judged. Number 3, encourage them to get help sooner than later. It's more likely that that person will get the help that they need the sooner that they get there. Number 4, support recovery as an ongoing process. People seem to think that recovery happens overnight. That's not always the case. Recovery doesn't always happen in a week, a month, not even a year. You just need to be patient. Number 5, a lot of people don't think about this, but you need to take care of yourself. You need to be at your physical and mental best when you're trying to help the ones that you love the most. If you're not at your best, they won't be at their best. They're counting on you to be able to lean on, so you need to be at your best for them. Number 6, educate yourselves on the signs of addiction. The more you know, the easier it gets. When you recognize those signs early on, you can get them that help early on. Like I said in number 3, the earlier you get them to the help, the easier it is for them to be helped.
What signs should you be looking for? Number 1 is physical health issues such as lack of motivation, energy, weight loss, or weight gain. Number 2 is neglected appearance, such as lack of motivation to go shopping for clothes, grooming, or self-appearance. Number 3 is problems with missing school and or work, not getting your job done, not doing your schoolwork, and making bad grades. Number 4 is money issues, randomly requesting money from other people without reasonable explanation, money going missing, indicating that you are spending them on drugs. Number 5 is changes in behavior, such as trying to bar your family out your room and not let them know what's in your room and being secretive about it, and going out with friends.
And if you yourself think that you may be suffering from addiction, look for those same signs, as well as having intense urges for the drug that blocks your other thoughts, making sure that you have a supply for the drug, spending most of your time thinking/using the drug, and cutting back on social or recreational activities because of the drug.
There are many distinct types of addiction in the world, but the four most common being alcohol, the most common addiction, tobacco, gambling, and drugs. There are lots of drugs out there that lead to addiction, but the most common being methamphetamine, hallucinogens, heroin, cocaine, prescription drugs, and marijuana. As a concept, the 4 C's of addiction were created to distill the disease of addiction to its most fundamental parts, which are compulsion, cravings, consequence, and control. They have since become a useful way to describe or even identify addiction.
Addiction itself can be classified as mental illness because addiction changes the hierarchy of needs and desires in the brain. Drug use can be put into two categories: drug abuse and drug dependence. Drug abuse hinges on the harmful consequences of repeated use, while drug dependence includes compulsive use with the buildup of tolerance over time.
In the year 2022, over 37 million Americans from the range of 12 and up were using drugs. Over 28 million Americans are addicted to alcohol. 25.4% of drug users have a drug addiction. 24.7% of people with drug disorders have an opioid disorder. If you or someone you expect is suffering from addiction, call the national helpline number at 800-662-4357.